Most people only think about osteoporosis when a bone finally breaks. But the truth is, your body often gives quiet warnings long before that happens. The challenge is that many of these signals feel like ordinary aging, so they're easy to dismiss. Did you know that after age 60, about 1 in 3 women and 1 in 5 men will develop osteoporosis? Yet, many don't realize what's happening until a simple fall, a sneeze, or even just bending over leads to a painful fracture. Here's the good news. Your body is constantly trying to tell you what's going on. If you learn to notice the subtle changes like shifts in posture, persistent aches, or unexplained weakness, you can act early. Protect your bones and stay independent for longer. In this video, we'll uncover the most important symptoms of osteoporosis, explain why they happen, and show you what your body is really trying to say. By the end, you'll know the early signs to watch for and the steps you can take to guard your bone health. Osteoporosis is often called the silent thief because it weakens your bones slowly, without pain, and without clear warning. But if you pay close attention, your body does drop a few quiet hints. One of the first signs many people notice is a small loss of height. Maybe you've found that your clothes fit differently, or friends say, you look a little shorter. Often this isn't just posture, it can be tiny fractures in the spine that make the vertebrae compress over time. Along with that, your posture may begin to change. A slight rounding of the shoulders, or a gentle curve in the upper back, sometimes called a dowager's hump, can be more than just habit. It can reflect weakened bones struggling to hold you upright. Even everyday strength can tell a story. If opening jars, carrying grocery bags, or gripping handrails feels harder than before, that weakening grip could be linked to declining bone density. And though it may sound surprising, even changes in your nails becoming brittle or breaking easily sometimes mirror changes happening in your bones. Individually, these signs may seem harmless, but together, they create a pattern your body is asking you to notice, and the earlier you recognize them, the more power you have to act. Whether that means speaking with your doctor, adding more calcium-rich foods, or doing simple strength exercises at home. So take a moment this week, check your height, look at your posture in the mirror, and notice whether daily tasks feel different than they used to. These quiet clues may be your body's way of saying, pay attention to your bones before it's too late. While early osteoporosis can feel almost invisible, as bone loss continues, your body often starts to speak louder. One of the clearest ways it does this is through pain and changes in movement. Many people first notice persistent back pain. It's not the sharp pain of an injury, but a dull, nagging ache that lingers day after day. This discomfort often comes from tiny fractures in the spine, called compression fractures. They may be so small you don't even realize they've happened, yet they can cause ongoing soreness in the back or neck. Posture changes are another signal. You may feel yourself leaning forward slightly when you walk or sit. Clothes don't fit the same way, or friends might comment that you look more hunched over. These shifts aren't just cosmetic, they show that the spinal bones are weakening, and the body is struggling to hold itself upright. Sometimes, the clues appear in how easily you get tired. Tasks you once did without a key, thought carrying laundry upstairs, gardening, or standing for long periods may suddenly feel draining. This isn't only muscle fatigue. Weakened bones and microfractures can make every movement more taxing. Even how you move through the world can change. Shorter steps, slower walking pace, or a tendency to shuffle rather than stride confidently all can reflect your body's natural effort to protect fragile bones. It's easy to brush these symptoms off as normal aging, but in many cases, they're your body's way of warning you that bone strength is declining, and recognizing them matters, because pain and posture changes often happen before major fractures occur. The good news is, noticing these clues doesn't have to create fear, it can create opportunity. By listening to your body, you give yourself the chance to act before a serious fall or fracture. So, if you've been living with unexplained back pain, a hunched posture, or sudden fatigue during simple tasks, don't dismiss it. Write it down, track when it happens, and bring it up at your next doctor's visit. Those small notes could be the key to catching osteoporosis before it catches you off guard. Not all the signs of osteoporosis are visible on the outside. Some are hidden within your daily experiences, little things you might ignore. But together, they paint a clear picture of what's happening inside your bones. One of these hidden signals is unexplained bone or joint pain. You may feel aching deep in the hips, wrists, or ribs without any clear injury. This discomfort often comes from bones that are slowly becoming weaker, even if they haven't fractured yet. Another clue can be sudden muscle cramps or weakness. When bones lose density, they can also affect how minerals like calcium are balanced in the body. That imbalance sometimes shows up as leg cramps at night, or muscles that tire more quickly than they used to. Perhaps the most striking hidden sign is a fracture from a minor incident. If you've broken a wrist after a light stumble, or cracked a rib just from coughing or sneezing, it's more than bad luck. It's a red flag that your bones are fragile. Doctors often call these fragility fractures, and they are one of the clearest signals that osteoporosis is already at work. But symptoms aren't the only story. There are also silent risk factors that raise the chance of osteoporosis even before symptoms appear. For example, family history. If your parents or siblings had osteoporosis, your own risk is higher. Medications, long-term use of steroids, certain cancer treatments, or thyroid medications can weaken bones. Lifestyle factors, smoking, heavy alcohol use, or diets low in calcium and vitamin D gradually chip away at bone strength. Hormonal changes. For women, menopause brings a sharp drop in estrogen, which accelerates bone loss. For men, lower testosterone levels with age can quietly do the same. These risk factors are often overlooked because they don't cause immediate pain, yet they work silently in the background, making bones more fragile year by year. The key is to connect the dots. Hidden aches, muscle weakness, fragility fractures, combined with personal risk factors, form a message your body is sending. And it's a message worth listening to. By understanding these internal signals, you can take action early, whether that's scheduling a bone density test, improving your nutrition, or talking with your doctor about safe medications. The earlier you step in, the better your chance of preserving strength and independence for years to come. If this feels helpful so far, take a moment to support this channel. It really makes a difference. Just tap the like button and let me know in the comments. Have you ever noticed any of these early warning signs yourself? Your experiences might help someone else recognize what's happening in their own body. And if you'd like more practical, science-based health tips explained simply, be sure to subscribe to Senior Vic Health. That way, you won't miss the next videos where we break down everyday health challenges and give you clear steps to stay strong, active, and independent. Recognizing the symptoms of osteoporosis is the first step, but what matters most is knowing what to do once you've spotted them. Let's break it down into simple, practical actions you can start today. The very first move is to talk to your doctor about a bone density test. This painless scan, often called a DEXA scan, measures how strong your bones really are. If you've noticed shrinking height, back pain, or had a small fracture, this test can confirm whether osteoporosis is present. Catching it early gives you more options for treatment and lifestyle changes. Next, nutrition becomes your best defense. Calcium and vitamin D are the cornerstones of bone health. Think of foods like dairy products, leafy greens, salmon, and fortified cereals. Vitamin D, especially, is often low in older adults, so safe sunlight exposure or a supplement may be needed. Protein is just as important, since muscles support your bones. So make sure you're getting enough through lean meats, beans, or dairy. Then comes movement and strength training. Many people believe they should avoid exercise if their bones are weak, but the truth is, the right kind of exercise makes bones stronger. Weight-bearing activities such as walking, dancing, or light jogging help stimulate bone growth. Add simple strength training with resistance bands or light weights, and you'll build muscle to protect your skeleton. Even balance exercises like Tai Chi can reduce the risk of falls. Another vital step is reviewing your lifestyle habits. Smoking and heavy alcohol use both weaken bones significantly. If these are part of your daily routine, cutting back or quitting can make a big difference over time. Also, check your home environment. Removing tripping hazards like loose rugs or poor lighting reduces the chance of falls, which is critical if your bones are fragile. Medications may also play a role. For some people, doctors may prescribe treatments that slow bone loss or even help rebuild bone. While these aren't necessary for everyone, they can be life-saving for those at high risk. The key is to have an open discussion with your healthcare provider about what's right for your situation. Finally, track your progress. Keep a simple notebook or use your phone to jot down any changes in height, posture, or pain. This record not only helps you notice patterns, but also gives your doctor valuable information for tailoring your care. The action plan doesn't have to feel overwhelming. Start small. Schedule that bone scan. Add 1 calcium-rich food to your meals this week, or begin a short daily walk. These little steps add up, and they put you back in control of your bone health. When it comes to osteoporosis, there are a lot of myths that cause confusion. Let's clear up some of the most common ones. Myth 1. Osteoporosis only affects women. It's true that women, especially after menopause, are at higher risk. But men are not immune. In fact, 1 in 5 men over 60 will develop osteoporosis. The difference is that men are often diagnosed later, which can make fractures even more serious. Myth 2. If you don't feel pain, your bones are fine. This is one of the most dangerous assumptions. Osteoporosis is called the silent thief. For a reason, it weakens bones without causing pain until a fracture occurs. That's why screenings and noticing subtle signs matter so much. Myth 3. Breaking a bone is just part of getting older. Not true. While falls are more common with age, healthy bones should not break easily. If you've fractured a bone from something minor, that's a warning signal, not just old age. Myth 4. Exercise is unsafe if you have osteoporosis. Quite the opposite safe. Weight-bearing and strengthening exercises actually protect your bones. The key is choosing the right types of activity and avoiding high-impact movements that risk falls. Gentle routines like walking, light strength training, and balance practice can be powerful tools. Myth 5. It's too late to do anything once bone loss has started. Thankfully, that's not true. While you can't fully reverse osteoporosis, you can slow or even stop bone loss with the right steps: diet, exercise, lifestyle changes, and in some cases, medication. Many people improve their bone strength and reduce their risk of fractures, even after diagnosis. By busting these myths, the message is clear. Osteoporosis isn't something you're powerless against. With the right knowledge and action, you can stay strong, mobile, and independent well into your later years. Osteoporosis may be called the silent thief, but as we've seen, your body rarely stays completely quiet. Subtle changes in height, posture, grip strength, unexplained pain, or even a fracture from something minor are all messages worth paying attention to. Add in the hidden risk factors like family history, certain medications, or lifestyle habits, and you have a clear picture of why bone health deserves your focus. The good news is, you're not powerless. By recognizing these clues early, talking with your doctor, eating for stronger bones, moving every day, and making smart lifestyle choices, you can protect your independence and stay active for years to come. If you found this video helpful, please give it a like, subscribe to Senior Vic Health, and share your biggest takeaway in the comments. Your story might inspire someone else to take action for their own bone health.